Okay. Hi, guys. This is Jordan, our lovely patient from Yorkshire, who traveled 6 hours to come and have the treatment. He basically uh, found me on the TMD TMJ support group. Yeah, tell us a little bit how you found me, Jordan.
So basically, I just kind of wrote into the group asking a question. I can't remember exactly what specifically the question was. And who was the gentleman who he'd written a book who
John
passed?
Moo.
Yeah, is it John Muir?
John Moo.
Yeah,
Yes,
so
he created that group. Yes.
yeah, so I sent a question in, and John Mew then sort of commented on what I'd put and mentioned to go and see Kalina, and he mentioned to go and see somebody who was qualified under what's the name? There's a
ICOI maybe.
yeah, that's the one.
Neuromuscular. I didn't realize that it was Mr. Moo that mentioned my name. Well, I'm very honored. Bless. So that made Jordan reach us, and yes, he drove with his friend for 6 hours. We took all the records. I did the evaluation, and it was quite obvious that he would benefit from creating more tongue space, decompression of the joints by increasing the vertical height, uplifting the teeth that were leaning towards the tongue space. And we just really we're just going out. And please tell us, what were your initial, symptoms? What was the worst?
So do you want me to explain a bit of a background why my situation was
Yes,
complex? Okay.
yes,
So
yes.
aside from the symptoms, the reason why my situation was complex is that I had taken some trauma to the jaw, probably like, well, about 10 years ago now. Um, so I was kind of always wondering, like, because I took this knock to the jaw, is that why I've got the jaw pain? But then at the same time, there were signs on my teeth when I went to a dentist that I was grinding my teeth and there was wear on the teeth. I was
Yeah.
waking up with a lot of tension. This was a couple of years after the actual trauma to the jaw. And
Yeah.
then after doing my homework a little bit and deciding to go and see a private maxillofacial surgeon, I was told that I had a hyperplastic maxilla. Is that the right terminology?
Yes, kind of hypermobility.
Yeah,
Yeah,
so a small upper jaw.
dislocating. Mm,
Yeah,
yeah.
um, and there were suggestions to sort of widen my upper jaw, but obviously that's quite an extensive surgery, so I was a little bit concerned about having that. But so the reason why it is complex is because I never really knew whether it was just the actual structure of my jaw naturally, or whether it was the trauma or the grinding or all
Yeah.
together. So the symptoms were lots of pain and hypertrophy in the right side masseter muscle. And
So there was kind of unevenness in, you could see, yes, that it was a bit
yeah,
more developed on one side. Yes, these things can happen. I mean, also the original, because often we are not symmetrical. There are reasons for that, and suddenly when there is a trauma, we compensate, and some muscles work harder to just keep going. And yes, and these discrepancies can be more noticeable.
yeah,
And patients, for example, like you maybe grew a beard and try to, kind of hide it a little bit. But yes, we can sometimes see the shift of the jaw. If for example, we have a pain on one side, we start to escape with the jaw from the pain. We tilt the head, we kind of have that little motion when we open and close to just avoid the tension. So these things can occur over time, yes, and will enhance over time.
yeah. Um, and the way that this was manifesting was the obviously, as I said, a hypertrophied right side masseter. So when you
Yes.
palpated on the muscles, this side was really hypertrophied. This side was kind of smaller, but the weird
Yeah.
thing was, obviously, this was coming from the grinding. I think because the left side, I could always get my left side of my teeth together, but I couldn't get the right side of my teeth together consciously. Um, so it was a very weird situation where I could kind of try and chew with my right side, struggle to get the right side together, or chew with my left side only. So there was, like you say, there was a complete discrepancy in
Mm.
the way that
You
my
did
jaw.
mention, yes, that when you came, that you can't really put them together.
No.
It's either one or the other. So that was quite concerning. Can you tell us a little bit about the pain symptoms, just anywhere? How on a scale 1 to 10, when it was the worst?
So the pain in terms of the tension in the muscles was just, it wasn't a high level of pain, but it was just a
Yeah,
constant irritating, tense feeling in the
yeah,
face. But then within the joint, probably within the year that within the year in the lead up to me coming to you, there
yeah.
was more stiffness. So waking up in the morning, there would be stiffness, and there would be more pain in the right TMJ. And
In
it
the
would be
joint
like sometimes a
structure.
sharp pain, sometimes there would be a
Mm,
crack or a pop, or I would open it and it would be just feel stiff and just feel really painful. And occasionally,
mhm.
if I'd been sort of grinding my teeth more, um, I just really struggled to chew any sort of food that was a
Yeah.
hard or tough food.
So it sounds as the muscles were continuously in spasm and they were literally struggling to relax, because when you do tense, you do use up a lot of potassium, magnesium, and then the body kind of struggles to just switch off. And that the inflammation, it builds up in the muscle, and the lack of oxygen in it. And also when we do clench, we kind of squash the joint. There was already a damage there. There might have been some kind of surfacing, rubbing on each other, creating even more kind of growth of the surface of the joint, creating even less space. There is a little cartilage in between that starts to get worn and squashed. So yes, there was evidently too much tightness there, because when we also before you had the impact, you did mention that the grinding was present. So that doesn't stop even though you had the injury. The origin now, that from to my best understanding of grinding and clenching, is basically to keep the jaw lifted, lifting the tongue so that the patient can breathe while you're sleeping. So even though you had the damage, you still were fighting to keep breathing at night. So all these two things, they just piled up on each other and eventually brought you to me.
Yeah.
Love. So, what we, like I've mentioned, what we designed for Jordan, we used Invisalign, and please don't feel that every Invisalign treatment is going certain way. It is a tool, and it depends how the dentist uses it. I use it to very slowly but surely expand the patients, and it's very controlled, because the incuspation means that the teeth fitting together, we have nice control over it. So even though Jordan is 6 hours away, I'm not worried that he will call me one day and say, I'm hitting on this one particular tooth and I'm getting really big pains, because it's all very controlled and very planned, because the tooth cannot move further than the plastic little tray allows. And hence, I have chosen this at this very point as a tool of, especially for patients who are quite far away from me. So do tell us, when did you notice changes? Were they good? How are you feeling today?
So I probably started to notice the biggest changes around, I think it was like, I did notice them instantly, in the sense that
Mm,
I was kind of getting a better contact of my teeth. I was closing them into a more comfortable position. If
mm,
I was to close my teeth together before, it would feel like I needed to make sure I relaxed them. Now it's almost like I can close my teeth together, and even 10 weeks in, 10 aligners in, I could
yeah,
close my teeth together and not feel that I needed to like remind myself to relax them. So that was the initial part. And that's when I sent you the text, that
yes,
the message that I think you shared. It was about
yes,
10th aligner, 11th maybe.
brilliant.
Um, so that was taking some pressure off the joint.
Yes,
And I would say that there were occasions probably leading up to about the 20th aligner
yeah,
where there would be little bits of pain, but far less than before. And I would start kind of realizing that I could kind of eat foods that I was unable to eat before with less pain or no pain. and then the next day wake up in no pain, and the tension had decreased. But now I'm at week 31, and week
Yeah.
31, now I'm at a point where most of my teeth meet when I close my jaw, close my mouth.
Brilliant.
Um,
And how many more do we have? I believe, how many were there in the,
so I've
was
got
it all?
52 in total. So we've
Yeah.
got, yeah, um,
Yes. So we are on the, did you say 30th? 30,
31st, so we've got 21.
31st. So you see, guys, the Invisalign increments, meaning the movement is 1/4 of a millimeter at a time. So that allows the time for the bone to actually be built. Hence, I am not so worried to really expand. And I do encourage you as well, when you have patients, when you see they're all really crammed and their jaws are squashed, and just just go for it. Don't worry if you will see anything concerning any recessions, but we do, really do expand, and they're not occurring because of those slow, gentle increments, not aggressive, rapid expansions where literally they're just tearing the ligament between the two bones. And what happens when it's really fast and aggressive, the bone doesn't get built in the middle. It is soft tissue that will eventually shrink away, like a trauma, like a cut. It will just bring the both of the arches back in place when you take out the appliance. But if you use those slow increments, and you can use different, you can buy a block. There are lots of really lovely devices. I have chosen Invisalign because it's really super control occlusion wise, especially when we deal with patients with TMDs. We don't want unfavorable contact, especially on the side where patients don't chew. I'm going to be a little technical, sorry, Jordan. But if let's say patient want to chew on one side and suddenly on the other their teeth are hitting, it's going to create a lot of tension. And that is when when we don't control where these teeth are actually meeting, are any teeth, kind of extruding too early. When you have an aligner, it can go further than the little plastic tray. So hence, uh, for Jordan, I've used this device. Lovely. So can you, when you mentioned the foods that you couldn't eat, what were they? What are the
So,
examples?
so for example, a steak or any kind of chewy meats, anything like that, I was just at a point where like it was just painful. And to be honest, like the actual period leading up to me finding you was
Yeah.
probably one of the worst periods. Like I was genuinely getting really down about it. Like I don't know. It was just kind of spontaneous. I wake up one day and I feel okay, and then I would wake up
Yeah.
another day and I would just feel like I couldn't even open my mouth properly or chew. And yeah, so it's
Yeah.
so those were the foods, but it was also the fact that I kind of started realizing that I could close both sides of my teeth together to chew any food. And I started to realize that this muscle on the side that I told you that had hypertrophied, so it increased in size, had then started to atrophy. So this muscle was starting to atrophy, so it wasn't working so hard to bring
Yeah.
the teeth into alignment.
Lovely. And so the both sides started to look similar.
Yeah, so now, yeah,
Tension.
there is more, it's a lot more equal. This side was just kind of really
Yeah.
pumped out
It's-
compared. If I closed my teeth together, this was pumped and it
Yeah.
was sore and it was tender.
Bless you. Well, it does sound, uh, as we managed to stop a very evil process that was really taking you to a dark place. And we can see on that forum, which Dr. Mew, Professor Mew has created, that it's really heartbreaking. Like the stories you hear, the patients are really suffering. So I'm really glad you're better, that I was actually had the understanding and hope that it will do the proper job, and you are in a better place, and that's
Yeah,
great achievement. So we're making this recording, guys, to just share that there is hope. There is hope. And I did mention to Jordan, I had my lovely patient today who had a really severe TMD. She just said that she can have Christmas this year, and she's so grateful that, yeah, we've done a similar treatment. So It's really, yeah, decompressing the joint, creating more tongue space in a way that it will stay. That
Yeah,
it's not a removable appliance. That is something that you finish your treatment and it won't change. And
yeah.
that's the aim with the orthodontic treatment. Thank you so much, Jordan. I wish you a wonderful Christmas. And yes, we shall be in touch and we're looking forward to further progress.
No problem. Thank you very much.
You're welcome.
Yeah, I just wanted to add to that that
Yes.
there are more, the side, the effects of it
Mm,
are more than just one. It's the fact that I wake up in the morning, there's no stiffness anymore. I get
yeah.
my teeth together when I want to bite my teeth together. I can chew any food that I couldn't chew before, and it's just improved my life completely. So I just want to add that the actual stiffness, the tension, the things that you kind of would maybe think if there's arthritis in the joint and people get concerned about that, that even those kind of symptoms, even if there
Yeah.
are changes to the joint, they have still improved. I just want to add that, that's because I feel it's important.
Brilliant. And also, if you can eat more varied food, you nourish your body better. Because if you start to avoid, let's say, nuts and things that are very nutritious, it also has an impact even on the mood, on the microbiome, and on the whole immunity. So there are lots of elements. And I'm just going to ask, when you said about tension, and did you have any tension in the neck as well? Did you have any of that? Any
Yeah,
headaches?
I kind of, I used to feel that I kind of needed to sort of push my neck into extension and stretch out that way because I kind of felt that
The
I had
release?
tension in the back of the neck.
Yeah. So for those who actually, kind of follow all the stuff I'm posting, the forward head posture to breathe better, yes, it puts a strain on the back of the neck. And when we can actually, when the pipe opens, we don't need to lean so much forward. The head retracts, and actually we don't have so much of the work that these muscles have to do, so they don't get painful and tense. And it's also a gradual process, because that retraction just actually is guided by the volume of the airway. I know there might be people who say, "Oh, I'm not so sure," but I am I'm quite certain, because that is the change that is taking place, and obviously in the joints as well.
Yeah, can
Is
relate.
there anything else you want to add?
No, I
No.
think one of the best. Well, yeah. To be fair, one more thing.
Oh,
The extra thing that I would add is just that now I kind of know how much it's improved my life because I kind of go a few days without thinking about my jaw. And then
wow.
I kind of say, oh, my jaw's not been hurt. Whereas like before, I couldn't go 2 days without being annoyed and fed up with it and explaining it and telling somebody. And I was at the point where I was fed up of telling people. Do you know, like when you feel like all you're doing is complaining? So yeah,
Yeah.
that's
Well,
what.
these are awesome things you're saying. I hope you'll agree also that we pop it on the same group where you found me, that
Yeah,
there is
of
hope.
course, no problem with that. And thank you.
Thank you as well. Lovely to see you, and yeah, we'll catch up soon. Thank you, Jordan.
Thank you very
Bless
much.
you.